Awesome. All right, so hello everyone and welcome to the Ontario NEIHR webinar series. My name is Adriana Gonzalez. I identify as a settler to this land, and I'm a current Master of Public Health student here at the University of Toronto. Today, I will be moderating Dr. Suzanne Stewart's webinar entitled Urban Indigenous Mental Health During the COVID-19 Pandemic, where research, practice, and respectful relationships meet. Dr. Stewart is from the Yellowknife Dene First Nation and is the director of the WAAKEBINESS-BRYCE Institute for Indigenous Health at the Dahlana School of Public Health, University of Toronto. She holds the TCP chair in Aboriginal Health and works in Indigenous health and mental health within urban organizations. Today, Dr. Stewart will address current issues of COVID-19 with urban Indigenous peoples, such as what happens to Indigenous peoples in cities when a pandemic hits. How can Indigenous and non-Indigenous organizations respond to the needs of the people in ways that are culturally based and safe? And how are the provincial and federal health and social service policies supporting Indigenous organizations? Examples from Dr. Stewart's current urban COVID-19 research will be shared. At the end of the webinar, we will open up the session to a question and answer period. Feel free to use the chat function to send in your questions. And now I ask the WAAKEBINESS-BRYCE Institute for Indigenous Health's Elder in Residence Clayton Shirt to do an opening before Dr. Stewart begins. Thank you.
Great. Good evening, my relatives. I'm going to say this opening in this language. I understand my language enough just to know if my elders are talking about me and say, come here, all this, all that. So I struggle with it like so many of us. So I just want to say welcome to everyone. It's good to be here wherever you are in cyberspace, etc., all these things. So miigwech to all of you for coming. Challenging times, difficult times, we're all in, but we're working together in our communities. And so I just want to say this prayer. And it's a prayer I try to live by every day of my life. I say it quite often. I say it every day, several times a day, constantly when I go through my days in my life. So I always like to say miigwech. I say thank you. Again, miigwech I'd like to acknowledge our first mother of all mothers. We come together as the people, we acknowledge her, we pray to her, I pray to her, we pray for her, we give thanks to our mother, the earth. She provides everything for us and our relatives. We give thanks to her. We ask her to help us in these difficult, challenging times, to have pity on us, that we forget so often that we are the people, the human beings, the Anishinaabe. We say miigwech to you. We ask for your medicine. We ask for your strength. We give thanks to you, to our first mother of all mothers, our mother, the earth. So our hearts, our minds can be one with this. We come together as the people. We send our thoughts to her, our hearts to her. We say miigwech. We love you. We say thank you. In many languages, we say thank you. We say miigwech to Father Sky. Again, we've offered our tobacco. We partition with our tobacco. We hold it in our hands. We offer our tobacco to that sky world, that spirit world. We partition, we ask our ancestors to be here with us, wherever we may be, to help us, to guide us physically, mentally, spiritually, emotionally in these difficult, challenging times. To give us strength to get through this, to work together as the people, to remind us, to help us, to keep our minds clear, our hearts open. We send them, we offer our tobacco to Father Sky, that spirit world, and to our ancestors. We give thanks. We come together again as the people. We say thank you for everything you do for us. To our ancestors, we say miigwech. So our hearts and our minds can be one with this. We say thank you. We give thanks to the Sun for this day, grandfather of grandfathers, for rising in that eastern doorway, for bringing a new day, a new beginning for us, for bringing warmth, for making the medicine grow for us. We give thanks for our relatives. We give thanks to you, grandfather, for this day. And if we have done anything in the past, I have this moment, this day to correct it, to make it right. And I give thanks for this and many other things for this day. Grandfather, Son, you're so beautiful. We say thank you. So our hearts and our minds can be one with this. We say thank you. We give thanks to Grandmother of Grandmothers, Nukumis. I send my thoughts to you, my prayers to you. Again, I pray to you, I pray for you. I give thanks for everything you do for us. I thank you for my heart. I ask you to have pity on me, to have pity on us. Give us strength in these difficult times. We send our voices, our hearts to you. I say miigwech to you, Grandmother of Grandmothers, Nukumis. I love you. Again, I say miigwech to you. As I sleep, as we sleep, as my granddaughter sleeps, as we all sleep, you do this for us. And I remind myself of this. I remind you put the waters, the rivers, the lakes, the oceans into order for us as we sleep. I say thank you for my heart. I love you so much. I say thank you for this, for we acknowledge this as the people, for water is life, that sacredness of water. We thank you, Nukumis, for doing this for us. I send my voices, my heart to you. Give us strength in these difficult times. So we come together as the people to work together as the people. We say miigwech to you, Nukumis. I love you. I say miigwech. So our hearts, our minds can be one with this. We say thank you. And to our Creator, the great mystery, we offer our sema and gratitude for this medicine we hold and the medicines we use to clear our minds, to open our hearts. We give thanks for this beautiful gift you have given us, life. I thank you for my heart of hearts. We come together as the people to work together as the people, to help our people. We come together to have good words today. We say miigwech to you, Creator, again and again, for there is nothing beyond you, Creator. I say miigwech to you for this beautiful gift, and I ask for your blessings for all of us to keep us well, give us strength in these difficult times. I plead with you, I ask you, have pity on us, that we forget so often that we are the Anishinaabe before we are anything else, the people, the human beings, and I thank you for this. May this always be in my mind and in our hearts. I say thank you for my heart, Creator, for this beautiful gift called life. All my relations, miigwech, miigwech, miigwech. Thank you for allowing me to do this and say that simple prayer in this language. So, miigwech for allowing me to do this. All my relations.
Miigwech, thank you, Clay. I'm Suzanne Stewart, and I'd like to express my gratitude to Clay for opening us spiritually, and to Adriana for hosting our webinar today. Thank you very much. And I'd like to say thank you also to everyone who took the time out of their busy schedule to be here today. So I really appreciate everyone supporting what we're doing here at the WAAKEBINESS-BRYCE Institute for Indigenous Health and with the Ontario NEIHR. So I'll just say I'm just feeling a little bit nervous for some reason. I do public speaking all the time, but I guess doing it sort of at home with my people, I feel more nervous. When I get up in front of 1,000 people that I don't know in a different place or country, it doesn't seem to be that big of a deal, but here I feel nervous. So please bear with me. And I will start my presentation so I don't keep blathering on anymore. And if you have any questions or comments at any time just put them in the chat, please. And we'll make sure that we answer everybody's at the end. So can everyone see that? Adriana, maybe just give me a thumbs up if everyone can see that. We're all good?
All good.
Okay, great. So, so I thought it would be timely to talk a little bit about the COVID-19 pandemic and
what that looks like from my perspective as an Indigenous health researcher, and from my position as not only an Indigenous person who's doing research in an academic setting, but that's also doing it in an urban context. And that's really been where my work as a researcher has taken me, because of where I've lived. I've lived most of my life in urban centers, and for me to engage in what I consider to be a respectful relationship, the way I was raised to learn about that, there has to be an element of reciprocity. And for me as a researcher, if I'm not living in an area where I can give back on an ongoing basis, it would be very difficult for me to engage in ethical research. So, but we'll talk more about that as we go through the presentation. I'd also like to just acknowledge where I am right now. So I'm from the Yellowknife Dene First Nation, as Adriana shared, and many of you may know. However, I no longer live in my own territory. I'm a visitor here in the Anishinaabe and Haudenosaunee territories, and I'm very grateful to be here. And I've sort of gone local, or gone native, as they might say, because some of you might know that I recently got married to a Mohawk. So I guess I'm really getting in with the locals. That's a joke. You can laugh. You can type laughing. I'd also like to acknowledge the other people who've helped work on this. And actually, this isn't even everybody, but these are the students who have really worked very hard on this COVID research that we've been doing, which we started doing in March to respond immediately to what was happening in our urban community. Christine, Kira, Devin, Adriana, and Michaela. Without the students, there's just no way that we could be doing this work together, and they've worked tirelessly. So Masicho to all of them. And we have a horse on our research team. That's also what we share in our pictures. And it'd be great if we really did. So let's just, I'll tell you a little bit about what we're going to share. So I'm going to talk about what an urban Indigenous response to COVID-19 has been in our work, and how that's caused us and helped us, given us the background information to develop some research questions and objectives, what that looked like, how we were going to answer those questions in research, and then sort of what some of the resources that have been developed are being developed from our work, and how we're going to share those results. And then we'll give some concrete examples from some of our work that we've done with some of our community partners here in downtown Toronto. So what does COVID-19 really mean for Indigenous populations? Well, probably everyone who's at this webinar is already well aware of what the situation is, and how there's a very deepening impact of the economics of COVID on our people in terms of education, employment. These were already very difficult scenarios for many of our people. As well as, healthcare is also the economic impact of healthcare has also been huge in the COVID-19 pandemic. But some of the other things that aren't always as easily measurable are things like social isolation, self-isolation, which, as we know, that's an important part of COVID, and that can be challenging for many Indigenous individuals, families, and communities. Water is also a huge issue for Indigenous people, especially in remote areas. The ability to travel places, whether you live in cities or remote First Nation, is also an issue, and that's tied to economics, of course. And the precarious employment that many people in our diverse communities, both urban, rural, and reserve, have faced has been really hugely impacted by the pandemic. When we look at sort of what this means when you break it down, well, we know that Indigenous populations as a whole are more vulnerable to COVID-19 community spreading because of the social determinants of health, and also because of the overburden of disease and disease and other healthcare inequities. Urban Indigenous people have also been largely ignored by government and healthcare responses, despite statements that have been made by political leaders at the provincial or national levels. Indigenous communities are actually not getting direct messages from the government about COVID safety protocol, about testing, about treatment, about self-isolation, about anything. And as a result, misinformation is being circulated in Indigenous communities in many different ways, including online. Indigenous healers and elders are not being consulted by the government or by biomedical systems in trying to manage the pandemic. And government is continuing to impose colonial models of healthcare and public health on both reserves and urban Indigenous settings. So that being said, there are a lot of reasons why we would want to create an urban Indigenous response to COVID-19. And, you know, to kind of put it in a nutshell, we know that despite moderate to weak efforts by the healthcare system to inject cultural competency and culturally based services into different systems, we know that Indigenous people continue to have poor experience of healthcare services in urban settings. And this is really critical when we're in the middle of a pandemic, because Indigenous people are extremely vulnerable to these higher levels of community spreading and fatal outcomes because of all of the problems that have been foisted upon us through what the public health system calls the social determinants of health. And I say that in quotes because the social determinants of health for Indigenous people are not determined by Indigenous people, but are determined by a Western biomedical system of health. So we're unhealthy because we're being measured by non-Indigenous methods of metrics in terms of what is healthy, and then the whole system that we're plopped into sets us up only to be unhealthy by its rules and by the services and supports that were offered within that system. So further, really, except for one that's being developed right now by my colleague Janet Smiley, none of the current COVID-19 assessment or treatment centers that are run by the healthcare system have been developed or adapted for Indigenous people with any of these issues in mind. And as far as we've been able to find through the work of our research team, no pandemic assessment or treatment models have been evaluated or developed through evidence-based Western or Indigenous methods, and there's been no proposed follow-up with Indigenous people in an Indigenous paradigm to determine outcomes. So really, it's a glaring need for us as Indigenous people to create our own response based on our own knowledge, our own science, and our own research. Indigenous services and interventions are difficult to measure from Western paradigms, and really there are currently no widely used evidence-based Indigenous evaluation frameworks. Organizations, some First Nations have developed Indigenous evaluation frameworks that are program specific, but really there isn't anything that has really been developed in a way that the Western system has been able to take those up or even wants to take them up. Indigenous traditional healers have been reluctant due to historical and ongoing colonization of health services and research to engage with universities to evaluate their work. And health services in healthcare systems for Indigenous people tend to focus exclusively on Western biomedical health interventions with little or no emphasis on culturally safe or culturally based models. And the services in the city of Toronto are really no exception. So I've been working with Indigenous communities for about 14 years here in Toronto. And when the pandemic started to really take hold in March, a few of our community agencies reached out to me to see if we could work together on addressing some of these concerns. And I'm working with actually a number of different agencies right now on the pandemic response. But here in this presentation, we're just going to talk about the work that we're doing with Native Women's Resource Centre of Toronto and Native Child and Family Services of Toronto. So what these organizations are really interested in knowing is, how do urban Indigenous people access and use health services for COVID-19? And what culturally based health information and services are most effective at preventing and ending COVID-19? So really what we wanted to do is really work from a community-driven model where the community decided sort of what it is we wanted to know, how we were gonna find out the information to these questions, and then what we were going to do with it. So in other words, what that means is we really wanted to use a research framework and a way to look at the services that have been offered during the pandemic and really examine those from an Indigenous knowledges framework. So we have sort of a couple of overarching objectives to this work. And one is to really develop a database of information about COVID-19 services that could be available to people widely in the community. And that goal is really aimed at meeting that need to provide evidence-based information to Indigenous people so that they could make informed choices in terms of their behavior, accessing healthcare services, avoiding contracting the virus, and whatever else they needed to do to become safe or to be safe during a pandemic. And this was really to be created through the development of working with community partners, with elders, with traditional knowledge keepers. And this is something that we've been able to do, and other successful Indigenous community-driven research teams have also been doing this across the country, which is really wonderful. The second objective really has been to create and evaluate Indigenous health COVID-19 assessment and treatment models for use in clinical settings that can both prevent infection and support successful treatment. And really, this is in order to support our people in going for testing, for assessment, for treatment, and to be able to do that in a way that's culturally safe, because we know, all of us on this call already know that one of the big issues is that many of our people don't go for healthcare support, intervention services when they need to or feel like they should because of the racist or other unsafe treatment that people get, and that racist experience has detrimental and indeed fatal outcomes. So, you know, these are the types of things that we're trying to prevent from happening. So in our research, we use Indigenous knowledges as both conceptual and operational framework. And how we do that is really by using a collaborative community based design where we work with our community partners to develop every aspect of the project and to have community governance in terms of ownership, possession, control, and access with something that goes beyond what are traditionally used in universities, which are data ownership, or sorry, data sharing agreements, to basically agreements in which we agree that everything belongs to the community partners and is held where they want it to be held, and nothing is done without their permission. So this includes, you know, meaningful and ongoing engagement from the traditional knowledge keepers who are employed and work on our research teams, as well as members of staff and leadership from the community organizations who are part of the research team and who engage in weekly meetings with us to ensure that they are directing what happens both procedurally and conceptually in the project. And from a methodological sort of perspective, I guess we use something called Indigenous narrative inquiry, which I first started using as a doctoral student, you know, way back when, and have refined in the research I've done over the last 15 years. Our steering committee, as I said, is really what governs the project, and that is an integral part of it. It's not really a steering committee, it's more of a governing committee, and we should probably change the name of that, but that's really the backbone of the projects. So, you know, this table is the text is a little small in there, so I'll just share with you sort of what we're planning to do, and that is that what we're planning to do is, with our community partners in each site, is develop surveys and do individual interviews with clients, staff, community members who have used our community partners' COVID services over the course of the pandemic, from when it started in March to now, and then to basically ask everyone who's been involved, you know, how did these services help them? What were the gaps? What were the strengths? How could they be improved? You know, how could urban organizations such as, you know, Native Child or Native Women's improve or change their services during a crisis, during a pandemic? What is it that's been working and what hasn't? And this is really all sort of voluntary. Whoever wants to come forward within the staff of the organizations or clients who have been using their services during the pandemic. And we worked very hard with our community partners to develop these surveys where, you know, we as the research team with the sort of academic expertise, and I put that in air quotes really because we know that academic research has not been useful or helpful to communities, but where we've brought some of our sort of procedural knowledge around that and worked with communities to draft these surveys and these interview questions, and to get them to answer the questions that the organizations want to know, so that they can have the information and that we can work with them to help them develop pandemic response toolkits, manualized training for staff on how to develop and deliver these types of services during a crisis or emergency. Because while COVID will be over, hopefully in the next year, our communities do face many epidemics and other crises where it would be great to have a manual that would give people an idea of how to respond to these in a systematic way that we know has worked in the past, and to be able to improve on the things that we were able to discern didn't work. So it's sort of like creating an Indigenous evidence base of what to do when a crisis erupts in a health and social service organization setting, based on what our elders say, what our clients have said, what Indigenous research, other Indigenous researchers have said, to bring that all together in an organized way. And that's what our community partners have said would be helpful. So, you know, the data analysis part of that is that, you know, we do engage in some Western style data analysis, and we do that in a way that is collaborative with our community partners, including community youth research assistants, other information that we've gotten from community consultations that we've done with the wider community, including elders and other knowledge keepers that our community partners have asked us to consult with, to ensure that our process is spiritually and culturally meeting the needs of local knowledge keepers. So these are sort of the things that we engage in and how we sort of roll out a project like this. So, you know, what are we going to do with it? Well, what we're going to do with it is really going to depend on what our community agencies need us to do. Of course, from a university perspective of academic research, you know, the university expects me and our team of wonderful students to do things like write articles in peer-reviewed journals, checking the time here, write articles in peer-reviewed journals, go to academic scholarly presentations, and those are things, you know, that we will engage in, and I really push and ensure that our community partners are included as authors in those publications, or are invited to attend conferences with us, and are aware of what we're doing and how we're doing it. So we need to ensure that we share the results with everyone who could possibly use them in a good way, and that those results are presented in a way that meet the needs, first and foremost, of, you know, the people who are involved in the research and the community partners who are driving it. So some of the examples of some of the services that have been developed during the pandemic, and that are being evaluated within this study, are the pandemic hotline that was developed, that our research team developed in partnership with Native Women's, in order to allow the clients of that organization to access immediate services, even while the organization was closed because we were in lockdown in Toronto at the time. So, so we used our research funds to pay for a hotline service. All of our research team created a training manual for the hotline, which was a referral hotline. And we trained everyone on the team and everyone on the research team, as well as some of the staff from Native Women's, worked on the hotline to keep it running all the time. Even I had a shift on the hotline on Fridays, which was very exciting for me to be answering a hotline and doing that frontline work. So that was one of the things that we developed as part of this project, and that's going to be evaluated from an Indigenous framework to see if it actually made a difference to people's lives during the pandemic. Many other services were developed by the partner organizations on their own without our support. But when they said, hey, you know, we need to develop this and we don't have resources for that, we stepped in and used our research funds to do that. And some of the other examples of that is that we paid for a block of hotel rooms for 2 months so that women who were fleeing abusive situations and couldn't go to a shelter because the shelters were closed had somewhere to stay. That'll be another piece of the evaluation. We also paid for PPE for some of our community partners so that their staff could get working in a safe way. Because what we found with our community partners is that the government, either at provincial or municipal levels, was actually not providing any of the supports that the organizations needed to continue to service their clients during the pandemic. And this is especially during the first wave. So while the city had promised urban Indigenous organizations that they would provide them with emergency accommodations for their clients, it took a long time for that to come out, to actually come to pass, even months later, when it really wasn't as necessary, when shelters started to open up. So we feel grateful that we were able to support our organizations in meeting those needs, and that we were able to do that in a way that not only contributed to what the community needed in terms of that reciprocity, but also can contribute to the Indigenous knowledge base of showing how we can create programs driven by Indigenous knowledges and need, and we can also evaluate that from Indigenous knowledges perspectives in a way that demonstrates that it actually made a difference. There are other projects that our team also works with, and that's the Ontario NEIHR. Some of you may be aware that we're also doing this other work. And the Ontario NEIHR is the Network for Environment for Health Research for the region of Ontario. And that sits at the WAAKEBINESS-BRYCE. And we have dozens of Indigenous community partners across the province, the country, and internationally as part of this. We have around 16 equal partners on this project between myself and the rest of the team, who are all the Indigenous mental health leaders in their fields across Ontario, Canada, and internationally. So I feel really lucky to be involved in this and sharing this work with everyone else. And the Ontario NEIHR, while it's focused on Indigenous mental health, we've really shifted to do a lot of our focus of what we're doing across our theme groups to be looking at the mental health impacts of COVID-19 on individuals, families, communities, and what that really means. So that's been very exciting to do that. Another thing that has recently come up through my involvement with the NEIHR is Indigenous Journeys Through COVID-19, and that's a national Indigenous zero prevalence cross-sectional and community sentinel cohort study. Now, this is in a very early stage of development, and it's a national study by which I've been asked to lead the Ontario cohort for this. I'm in the process of continuing consultations with Indigenous communities, leaders, and stakeholders across Ontario to create a regional governing council that will determine everything that happens in this study, what types of data collection happen. Everything needs to really be addressed from an Indigenous ethical perspective and needs for this to go forward. And that's going to take a lot of community engagement. So it's at a very early stage with that, and I'm happy to talk about that or invite anyone who wants to help with that to join. I've also been working with Janet Smiley's team at the Well Living House on an urban Indigenous response to COVID, which has really fulfilled that piece, and I call it kind of the dream of opening an Indigenous COVID-19 assessment center with our partner Native Men's Residence. So we have the first Indigenous assessment center that's open in downtown Toronto that just opened a couple of weeks ago. So that's very exciting, and I'm really thrilled and honored to be part of that work as well. And that's it for the presentation. So I'd like to say Masi Cho, Miigwech, and I'd love to hear any feedback or questions if anyone has any.
Thank you, Dr. Stewart, for this wonderful presentation and sharing your expertise and research in the area of Indigenous mental health within the COVID-19 context and beyond. So as Dr. Stewart said, we'll be taking questions now. So if you wanted to pose the question in the chat function, please feel free to do so. I see that we actually have one already. So I'll just go ahead and read that out loud for you, Dr. Stewart. So the first question is, could you please explain the definition of a traditional knowledge keeper?
Clay? Clay might have gone into the
Yeah,
lake.
I'm here. Sorry, I was listening.
Can you please define a traditional knowledge keeper?
Well, traditional knowledge keeper. I mean, there's you got to tell a story, a backstory of elders. Just I'll try to be as quick as possible. There are elders and elderly, right? An elder is somebody with tremendous knowledge, tremendous experience, right? And indigenous ways of being, etc. And then there's elderly, right? You're just elderly. But with an indigenous perspective, I'll use that word indigenous, they are still respected equally, right? So, but so much of our elders are passed on, right? And they've handed down that information, that those teachings, etc., to the next generation. And so I've been called an elder. Don't consider myself one. I got lots of gray hairs and everything, but I'm just, I'm just old, right? I'm just all these things. So an elder is somebody with tremendous wisdom and experience, and so we hold them with the highest degree, right? And so there's very few. So they passed on. They're moving. They're moving. They're passing on, and so the next generation who are looking, who are trying to practice their traditional ways of being and their culture, all these things. And so the Western world is asked to have elders involved, and they said, okay, well, yes and no, we would like to be involved, with not so, but so they said, okay, well, here's some traditional people. So the Western world gave us that title, right? So, a knowledge keeper, knowledge holder. I just consider myself a practitioner of my spiritual beliefs, right? A practitioner, like all the other faiths, all the other spiritual practices. So that's a knowledge holder. And so I'll just say this. There's no, to me, this is my opinion, and I think it's my own view on this. There's no such thing as a self-proclaimed elder, right? It's a community that says, hey, we acknowledge you. We acknowledge you as our elder, and we want to lift you up and hold you in that place of an elder, a knowledge keeper, someone, all of this, knowledge holder, practitioner, etc. So that's my definition, I guess, as a knowledge holder, somebody who's a practitioner of their belief systems, their spiritual ways, everything. Hopefully that answered your question. Get that a lot, right? What it is, what's a knowledge keeper, what's a knowledge holder. It's again, I'll just say this, it's something that we Western world, and also we as my generation has had to come up with certain titles, right? We've had to come up with certain words to go along in the Western way of medicine, etc., and all the Western ways of being. So I don't know who came up with the word, but my generation, that's what we're calling ourselves: knowledge holders, knowledge keepers, etc. So yeah, so Miigwech, hopefully that helped.
Thank you, Clay. That was a great response.
So we have another question. Do you have any suggestions for actions that those of us at the individual level can do to help reduce the impact of COVID-19 on communities that face health disparities? And how would one include those use of anti-oppression praxis within this work?
That is a really great question that hasn't got one answer. But I like the way it was framed as asking about suggestions or actions, because I think that's really what it comes down to is, what is it that we can do to try to make an impact on how the COVID-19 pandemic is affecting Indigenous communities that face health disparities. So I guess the answer would really depend on who is asking the question and what their position is. And I guess I might answer it the same way I would answer a question I get asked sometimes, which is, how can we engage in Indigenous reconciliation? Which is really just about, educating yourself and the people around you, the people who are listening to you about what Indigenous health is, and whatever it is that you can do within the realm of your position to make an impact on that. I mean, if you're working in healthcare, obviously you want to try to bring cultural safety lens to what it is that you're doing and drawing that attention to your colleagues and even to your supervisors and leadership, whoever they may be, the importance of using a cultural safety lens, as well as, cultural safety training. I know that's going a bit far sometimes because, you can lead a horse to water, but you can't make them drink. The horse in our picture. It's just another horse joke. But I think really just, informing yourself as well as choosing what you're going to do with your work and your time. I mean, any of us who are here working on this research and any of us who are here listening to this talk, we could choose to be anywhere or do anything, but we're choosing to engage with Indigenous research and with addressing the Indigenous COVID-19 pandemic. And maybe it's because we're Indigenous, or maybe it's because we're not, or maybe that has nothing to do with it. I'm a psychologist, a clinical psychologist. I could work anywhere and do anything I wanted, but I choose to work with my people and to, do things. And in fact, I even do things that aren't even really my passion. So for instance, like the COVID seroprevalence epi study, that wasn't something that I would ever sort of choose to do, but as a call to duty because of my ability to engage with community, to bring together researchers, to ensure that ethical protocols are followed and to make sure that they're done in a way that's community driven and community based. That leads me to have to do things that I wouldn't necessarily want to engage in, but I do it because I know that it can make a difference and it can help people. And when we're talking about the pandemic, that's a matter of life and death. And in fact, when we're talking about any Indigenous health issue, it is a matter of life and death because Indigenous people are more likely to become critically ill or die from any kind of engagement with the healthcare system as compared to non-Indigenous people because of the racism that we experience in the healthcare system. So I think, just being here, being interested, caring, devoting any aspect of your work to Indigenous health is what anyone could do if that's what they wanted.
Great, thank you. And then the last question we have here, is there any data on the infection rate among Indigenous community members on a national or regional level?
So, the study I was just talking about is something that is interested in sort of addressing that question, and there is So there are issues with Indigenous data collection that are to do with an abominable history of harm by researchers on Indigenous people in every population demographic. But I guess to answer your question, yes, there is some data. Who that data is collected by and what's done with it are more dubious in terms of validity, generalizability, and overall soundness. So the government of Canada has collected some data on COVID rates from First Nations only. So you have to remember that the Indigenous population, which wasn't really called that until Canada was settled by Europeans, the original people here are very diverse with different multiple identities that are tied to geography, to culture, to social demography, to many different things, to gender, to sexuality, to everything. And so there's no sort of homogeneous Indigenous population that could be identified that way, because we have First Nations people who live on reserve. So we have status and non-status Indians on reserves, off reserves. We have status and non-status Indians. We have Métis. We have Inuit. We have people of all kinds of different distinct, unique Indigenous identities who are not measured in the government's collection of First Nations COVID data. I believe the data that Health Canada has collected says there's about 950 Indigenous people on reserves who have COVID that has been reported. And this is probably very uncertain, and I would be very skeptical of the validity of that, because there's huge methodological and ethical issues with the collection of Indigenous data in general, but First Nations data specifically, because how they collect a lot of this data has to do with their method of collection, which for First Nations is often through postal codes, which isn't always relevant to actually where people are living, especially on First Nations, because they may be collecting their mail somewhere else while they might actually live on the reserve. For example, just to give a simplistic answer, the First Nations Health Authority in BC, FNIGC and Chiefs of Ontario, the Métis Nation of Ontario, they all have regional surveys that they have used and are continuing to use to collect data from those communities. And I would say that their information is a lot more valid and ethical than what you might find from the government. So the short answer is we don't have really any substantial pool of data that we can talk about, because so many of our people live off reserve and may not participate in data collections for obvious reasons, or self-identify as Indigenous within the healthcare system. And there's all kinds of very complex yet very simple ethical dilemmas with Indigenous health data collection. And the only people who can really address and deal with those are the Indigenous communities and leadership themselves. So.
Wonderful, thank you. So those are all the questions we have. So I just wanted to say thank you so much, Dr. Stewart, for, again, this wonderful presentation. And thank you so much for everyone who attended the webinar today. I will now pass it. Oh, did you have a question? Sorry.
I just wanted to say one more thing, and I wanted to say how humbled I am to really be here with everyone, the other people on this panel, Adriana, our elder Clay, and the NEIHR coordinator Roy, and humbled also to be with everyone who's listening here. And I really appreciate you all coming, and I really encourage you to reach out to me via email or telephone if you want to talk to me about any of these things to do with this research or anything else. So I'm very grateful, and I'm here to answer any questions or work with anyone who wants to work with us. So Masi Cho.
Wonderful, thank you. And so if Clay wants to do the closing, thank you so much.
Okay, Miigwech. Thank you again, Miigwech, for allowing me to come here and just say a few the closing in prayer. I just want to put things into perspective here. As it has been a challenge for a lot of elders and knowledge keepers. Traditionally, just paint this picture for you. We would be inside, we'd be all in our outside around a sacred fire. We'd all be in a circle. There was, and we'd be offering our medicines, etc. But because of COVID, we've been doing these traditional openings online. So it's been very challenging for us. For me, and to do these things online. So it felt uncomfortable. It's unnatural. It feels unnatural, but I'm getting used to it. And saying these openings and closings. So with this, I just want to so you have an understanding of why we do what we do. And so we always have someone to do a traditional opening and everything. But that's the beauty, one of the beauties of Anishinaabe people is we've always adapted, and we always will adapt. And that's we're always thinking on our feet, right? We're always going forward, right, in that big circle called our lives, and etc. So with that, I just want to say miigwech to everyone for participating here, listening, everything, and just being here. And it's, again, I wish everyone the best in these difficult, challenging times, and may you all be safe wherever you are, and your families and your loved ones, and we all be safe. And I just say this: may that virus, just whatever it is, just may it just pass, go over your home, right? Not through your home, not through all of this, and our people. And I was just talking to one of my elders, and she's from South Dakota, and she was telling me that there's so many people dying there, and she can't even go to the funerals. There's too many funerals to go to. So my heart goes to her and all the people there and all the other people who are suffering with this, and we're going to get through this. So I just say miigwech to our ancestors. We ask them to be here with us in a good way, in a kind way, and to give us strength, to give us to support each other in a good way, and listen to each other, and lift each other up in these difficult, challenging times. We give thanks to the earth, the sun, the sky, and to our Creator, the great mystery. Again, for there's nothing beyond you. We give thanks for this beautiful gift. And I ask for your blessings, this gift called life. All my relations. Miigwech, miigwech. Thank you for allowing me to say this. All my relations, everyone.
Miigwech, Clay, you're so wonderful. Thank you. Anyone wants to just hang out and visit, or, are we allowed to do that, Adriana?
Pardon?
Are we allowed to do that, or is the meeting over now?
Oh, no, I think Roy,